Let's see about complete denture. So it is a removable dental prosthesis that replaces the entire dentition and associated structures of the maxilla and mandible. This definition is given by GPT-8. So complete denture, it is a removable dental prosthesis and replaces the entire dentition and associated structure. So what are the objectives of CD? Functional objectives. The first one is compatibility with the surrounding oral environment, and the second one is restoration of mastication and harmony with functions of speech, respiration and deglutition, and fourth one is aesthetics, and fifth one is its most important, preservation of remaining oral tissues. So these are the functional objectives of the complete denture. So mainly patient wants complete denture for aesthetics and speech and mastication. These are the important reasons. Next, moving on to the surfaces of the CD. That is, it is given by Sir Wilfred Fish in 1948. There are three surfaces of CD. The first one is impression surface, occlusal surface and polished surface. So these are the three surfaces of the CD. First one is impression surface. Impression surface is also called as intaglio surface. The definition of this surface is the portion of the denture surface that has its contour determined by the impression. This definition is also given by GPT-8. So here the important point is impression surface is also called as intaglio surface. So this picture showing the impression surface. So the impression surface, the part of the denture in contact with the tissues on which the denture rests. So the fit of the denture depends upon the accuracy of this surface. It is very important, and it contributes to retention, stability and support of the denture. So this part of the denture is directly contact with the tissue. Is impression surface. The second surface is occlusal surface. The definition of this surface is the surface that is intended to make contact with an opposing occlusal surface is called occlusal surface. So this picture, the point marked as B is occlusal surface and the point marked as A is polished surface. So the occlusal surface that is aids in mastication and direct forces of mastication to the supporting tissues, and it contributes to the stability of the denture. The main purpose of the occlusal surface is mastication. And the third one is polished or external surface. It is also called as cameo surface. So definition, that portion of the surface of a denture that extend in an occlusal direction from the border of the denture and include the palatal surfaces. So it is that part of the denture base and that is usually polished, and it includes the buccal and lingual surfaces of the teeth. So polished surface or external surface is also called as cameo surface, and impression surface is also called as intaglio surface. So this polished surface, it was termed by Fish in 1948. It is the external surface of the denture without the teeth. So it should correspond to the contour of the lip, cheek and tongue. Contributes to the retention and stability of the denture. So this is the polished surface. That is definitely correspond to the contour of the lip and cheek. What are the components of CD? Denture base, denture flange, denture borders and denture teeth. These are the components of the CD. So first one is denture base. So the denture base, it is the definition of the denture base is the part of a denture that rests on the foundation tissues and to which the teeth are attached. This definition is given by GPT-8. So denture base, it is a part of the denture that rests on the foundation tissues and to which the teeth are attached. So it forms the foundation of the denture, and the forces applied to the denture are distributed and transmitted to the basal seat through the denture base. This is the purpose of the denture base. Mainly, it acts as a foundation of the denture. So the adequate extension of the denture base helps in providing retention and support. And denture bases are made of acrylic resin or metal. Usually we give patients with acrylic resin made CD. If patient needs more stability of CD, then go for metal. The first picture showing the acrylic and the second picture having the metal base plate. Next component of CD is denture flange. So definition of denture flange is the part of the denture base that extends from the cervical end of the teeth to the denture border. So it extends from the cervical end of the teeth to the denture border. This portion is called denture flange. So it provides a peripheral seal and horizontal stability. And it classified according to the vestibule where it extends. It has three flanges. They are labial, buccal and lingual. So labial, buccal and lingual, these are the flanges. The first one is labial flange. So the definition of labial flange is the portion of the flange of a denture that occupies the labial vestibule of the mouth. So it provides the lip support, and there is a V-shaped notch is provided in the labial flange to accommodate the labial frenum. Is very important. So labial flange, the denture occupies the labial vestibule of the mouth. That's why it's called labial flange. So this picture showing the labial flange marked as black borders. These are the labial flange that present on the maxilla and mandibular region, and there is a maxillar denture. There is a V-shaped notch. This picture showing the buccal flange of maxillary and mandibular CD. So next, moving on to lingual flange. The definition: the portion of the flange of a mandibular denture that occupies the alveolo-lingual sulcus. This definition is given by GPT 8, and it should maintain contact with the tissue of the floor of the mouth. It's very important. Lingual flange is present only in the mandibular denture, and there is a contact of the tissue of the floor of the mouth. That's why it's called lingual flange. So this picture showing the lingual flange of mandibular complete denture. So next component is denture border. So definition: the margin of the denture base at the junction of the polished surface and the impression surface. So denture border is junction of the polished surface and the impression surface. This definition is also given by GPT 8. This picture showing the maxillary and mandibular denture. The red line is border of the denture. It is responsible for the maintaining the peripheral seal, and it should be smooth and polished. Overextended denture borders may cause ulcers and hyperplasia, and underextended borders result in loss of peripheral seal and compromise retention. If it is overextended, they cause ulcer and hyperplasia. If it is underextended, there is a loss of peripheral seal and compromise retention. So the border should be smooth and polished. Next, moving on to the denture teeth. The functions of the denture teeth are to improve aesthetics, phonetics and mastication, and it is classified as based on the type of material used, that is acrylic and porcelain teeth, and based on the morphology of the teeth, it is anatomic and modified anatomic. If it is anatomic teeth, 33 degree or more, and modified anatomic between 30 and 0 degrees. So these are the types of teeth. One is material based and another one is morphology of the teeth.